Great. Well, welcome back, everybody, to the almost final session for the day. So I'm absolutely delighted now to introduce our second keynote speaker, who once again I'm sure would rather be here, but we'll have to bring you out another time, Donald, so we owe you, basically. We have speaking to us this afternoon Professor Donald Truxillo, who is a professor at the University of Limerick and previously a professor at Portland State University. And he's an organisational psychologist, but with specialist expertise around ageing, but also hiring, recruitment, health and safety, and as you will see, particularly also around interventions. So Donald is the associate editor for one of the premier journals in this field, which is called Work, Ageing and Retirement. And he has a very illustrious career. I won't go through the details, but hundreds of highly cited papers, teaching awards. He's been very involved in the US Society for Organisational and Industrial Psychology, and many more wonderful things. So without further ado, I will hand you over to Donald, who's going to share with you a bit more depth around interventions, which Donald is perfect actually, because in our presentation we shared some ideas and then talked about how we are working on interventions. And so the fact that you're going to pick up now and describe some interventions is a great follow-on. So over to you.
Great. Thank you so much, Sharon. Thank you for that nice introduction. Today, I'm here to talk about workplace interventions to support an aging workforce. And just to give a little more about myself, Sharon covered most of it, but I'm an organizational psychologist. I started out working in the public sector and then went to Portland State University for about almost 24 years. And I'm now a professor emeritus from Portland State, and I'm at University of Limerick. I'm also an associate editor for Work, Aging and Retirement, and also I'm currently editing a special issue for personnel psychology on age at work. And my work is focused, in addition to aging, on intervention research across a number of issues such as worker well-being, workability, job applicants, green behaviors at work. But I've really gotten excited about the aging workforce issues in the last 15 years, and that's the primary focus of my research these days. So the overview, I'm going to cover very quickly some changes associated with aging. A lot of these you may be familiar with. Also, I'll talk about some examples of workplace interventions to address aging issues and some best practices and lessons for developing effective workplace interventions. And a lot of the interventions I'll present today are actually going to, I've chosen specifically because I think there are good lessons to come from them. So what are some of the age-related changes? First of all, we know that there are physical changes such as changes in health, strength, endurance. That's as people age, they lose some of their health. Also, there are cognitive changes. Now, there's some declines, but there are also some gains. The orange line you can see here is showing what's referred to as fluid intelligence or working memory and processing speed. That tends to decline from when a person is in their early 20s. It's down after that. However, this is compensated for by what they call crystallized intelligence or crystallized cognitive ability, which is things like wisdom and job skills. And that continues to increase throughout one's work lifespan. And it's thought that the increase in crystallized intelligence compensates for the changes in fluid intelligence, and this is why there's relatively few differences between older and younger people in terms of job performance. Also, there's some slight personality changes. Personality is fairly stable throughout adulthood, but there are some, this is to the advantage of older people, there are some increases in conscientiousness, agreeableness, and emotional stability. Excuse me, and also when it comes to work, there are some slight improvements in job attitudes with age. For instance, increases in job satisfaction, a major meta-analysis found that. And also, there are relatively few age differences in overall job performance. But actually, there might be some slight improvements in organizational citizenship, safety behavior, and some declines in counterproductive work behavior. So again, all of these are to the advantage of older workers. But there are some losses, which, as I've described, in terms of physical abilities, certain cognitive abilities, and there are changes in what people might even want from work. And I think that's another thing to consider in doing these interventions. and I'm covering I'm doing this very quickly here and without nuance, but in terms of work motivation, there are increased intrinsic work motives, such as people wanting more meaningfulness at work. They're interested in the work itself, and they're also interested in relationships at work. There also seems to be increases in generativity motives, and that is giving back to the next generation. Okay, so again, this is what the research has shown. Now the issue is, how do we try to apply this in a way to think in terms of interventions? So how can we use interventions to help address these changes? So first of all, before I get into this too much, what do I even mean by an intervention? It's, a change an organization or a supervisor can actually bring about in the workplace, such as, it's a broad range of things, such as redesigning work, could be a major intervention, or just supervisor training to be more supportive of employees and know how to deal with them, or employee training. The idea here is they can benefit individuals, teams, or the organization as a whole. So it could be at different levels. The individual in terms of their behavior and health, the team in terms of the culture, and the overall organization. So this is just some ways to think about interventions in general. Now, what about some examples of interventions to support older workers and some lessons learned? I actually started out with several of these and realized I really needed to narrow it down. I'm presenting 4 interventions today that I think are sort of emblematic and also have some good lessons learned. This first one is a lifestyle intervention. And it's a well-designed study. It was published about 8 years ago. 730 Dutch hospital staff, they were over 45, so it was developed for older people. They had great measures to evaluate it. They had baseline measures. They evaluated 6 months after the intervention, 12 months later. They measured a wide range of things like vitality, work engagement, productivity, sick leave. And they had 2 conditions. There's a control group, and also then there was the group that got the intervention, which was they called it a lifestyle intervention, which means it's a lot of things. They offered people weekly yoga and workouts and aerobic exercise, coaching about their lifestyle and their eating, and ways to help them problem solve some of the problems that they're having in terms of their lifestyle, their health. The results were that the intervention worked, but only for people who actually took part in the yoga. They felt more vital. Okay, so I'm offering this, and the authors state this, that it really was a compliance issue. So workers were offered this wide menu, this array of different types of things they could partake of in this intervention. And really it was just, the yoga seemed to be one of the more effective things, and it was only if people participated in the yoga. And I think the lesson here is something that comes up a lot in interventions, is uptake and compliance. How do you get people to take advantage of it? And in this case, it worked for the people who actually used it. But then that begs the question, how do you get people to to participate in different interventions? This next one is a more substantial one in terms of a very major redesign. And some of you may have heard of this. This is a pretty well-known study, a workplace redesign that BMW did. And it was because they had aging production line workers who are having trouble with joints, arthritis, gripping, things like that. And so they wanted to keep these workers, and they decided to redesign the work to see if it would work. And they got the workers involved, and they got the unions involved, and they redesigned the workplace. They put in wooden flooring so it'd be more easy on people's knees. They gave people new footwear. They gave them workstations where you could adjust the heights of the chairs and the tables. They gave them stretching, and they gave them easy grip tools. In other words, they really redesigned the workplace with older people in mind. The result was that the new production line increased productivity by 7%. So even though this was a major investment, it also brought about a lot of major results, a lot of good consequences. And the lesson here, I think, is that it worked because it was developed with the stakeholders, employees and managers and technical experts and the unions, to help solve a specific problem, which was these physical requirements, and they worked with the employees to get them to accept it. Another workplace redesign study was this one done by L.L. Bean in the United States, the outdoor outfitters. They had older warehouse workers. This was only in the last few years. They had older warehouse workers that were facing health and safety problems in terms of lifting and such. So their intervention was also a technological redesign, in this case, of robotics and other technology to help with lifting specifically, combined with a fitness program. They, again, worked with the employees to see what they wanted. the results here was that they found that there was what they call a cost avoidance of $3 for every dollar spent on the program. And one of the things that was really nice about this program is that the younger workers were glad to have it as well. The younger workers were just as happy with this as the older workers. So it was an intervention developed for the older workers, but that benefited everybody. And I think that that's a major takeaway from a lot of these, is that a lot of times something that's developed for older people also helps everyone. And I think that's even better. And one of the other things I think it's important to point out here is that it's great if you can think of interventions that actually help people before they start having problems. So it's great to help older workers and with some of the issues they might be having physically, but if you can help prevent these problems from occurring in younger people as well, that's even better. This third one I'm going to talk about is something that is referred to as this team process. This fourth one is the team process is intervention, which is one that I worked with Leslie Hemmer and Todd Bodner on in Oregon. And this was, we did this from around 2011 to 2016. It was supported by the National Institute for Occupational Safety and Health. And in this case, we worked with older construction workers who are considered a vulnerable population in the U.S. This was with a public sector organization in the U.S. of about 500 plus construction workers. And they were generally older. Because it was public sector, people didn't retire or move out of the profession. So the mean age was 44, and lots of these people were over 50, which is getting older for somebody doing construction work. More alarming was that a lot of these people, in the sample, we found that large numbers of people had a high body mass index, and they also had high blood pressure. We even had some people during some of the initial tests we did, we had to send them to the emergency room because they were they had such high blood pressure. But we developed this based on past experience with interventions on what we thought worked and input from the employees, management, and the unions. And it was a three-pronged intervention. And this one's a little bit different. This was not a major work redesign, but it was much more team-based. First, we had online supervisor training about how to support employees and foster safety. There's a 1-hour online training, fairly straightforward. But the idea was that we were wanting supervisors to see how to support employees, maybe help them with work-life balance, taking care of issues outside of work, and to also support safety. The second part of the intervention was simply reminding the supervisors, after training the supervisors to support employees, to reminding them for 2 weeks on their smartphone to apply what they had learned. So once a day, they get an email saying, have you talked with your employees about safety today? Have you told anybody, seen if anybody has any needs or if they're having any problems that you need to help them with? And this third part was a group process, which was 4.5 hours of facilitated training where the group got together and talked about how they could become more efficient, get rid of, let's say, useless tasks that they do, but also how could they work more safely and support each other at work. And then there were regular follow-up meetings. So these are really the three parts of it: the supervisor training for an hour, supervisor reminders on the smartphone to try to apply what they learned at work, and then the group process of 4.5 hours with the facilitator. What did these, let me show you first just quickly this is the design of the study. There actually was a trained group or trained group of teams. And this, for the teams who were trained and not in the control group, they had the baseline data collection where we took things like blood pressure, other health indicators, well-being, the supervisor training, the reminders, the team process, and then we measured things 6 and 12 months follow-up. What we found was, in terms of the results, we were actually really excited because we found that blood pressure went down slightly in the intervention group, which is really something with what I would call a psychosocial type of intervention, to see blood pressure going down. It was not huge, but it was statistically significant. We also found that most of the benefits were for employees who needed help the most. And in essence, that means the team process intervention worked most for people who had poor relationships with their team members, or the teams that said they had poor relationships with each other or had a poor relationship with their boss. And that this seemed to, for these groups who had sort of had a low baseline, there was improved perceived crew effectiveness, improved work-life balance. And we see the lessons learned here from this fourth intervention that we did in Oregon. It was based on past research for what interventions worked. We went to what we'd seen the research showed worked. We involved employees and supervisors at all levels, including getting support from the top. And we also tried to tease apart what, when and for whom an intervention actually worked. Just to give you a little bit more about this, if you're interested in learning more, after this, we developed what we call a shortened version of this, or a more simply used version for smaller organizations, a WISE intervention. We also developed a version of this for medical professionals like nurses. So this is now available at the Oregon Healthy Workforce Center website if you're interested for dissemination to employers. I should also mention, while I'm doing this, I'll give a plug for the Oregon Healthy Workforce Center. There are a lot of other interventions there that are available at their website if you're interested in learning more about what different interventions are available. Okay, one last thing before we get into the final stretch is to mention, if you're thinking of tailoring an intervention for yourself, you want some ideas of what kind of interventions could be used for an aging workforce, is to point out I'm very excited about this. I just had this book that came out with my co-authors, Lisa Finkelstein, Franco Fraccaroli, and Ruth Canfer. The book is called Ageless Talent. It's published by Routledge. It came out 2 months ago, so we're still very excited about this. And this was to help people maybe come up with either large or organization-wide or simple supervisor led interventions. And it helps one tailor interventions for particular people and situations, but it's more focused on an aging workforce that covers issues from everything from motivation and then engagement to talent management, work-life balance. And the framework of the book is really kind of just a good framework for approaching interventions in general, which is what we gave the acronym, the PIERA framework. And we're saying that, you need to plan the intervention by understanding who you're developing it for and what the issues are, doing a needs assessment, develop the intervention and implement it, evaluate it, even if it's sort of a very simple evaluation, reflecting on what the evaluation shows, and then if necessary, adjusting the intervention. And usually there will need to be some sort of adjustment when you first put an intervention into place. But I just offer that in case you're interested in seeing about age-related interventions. Okay, so let's go into the final section of my presentation, which is what are some of the lessons learned from this, which I think is what I'm hoping was sort of the focus of all of this. And that is, first, it really is important to start with a needs assessment and think about what needs to be changed and why. When you're starting to look at thinking about any kind of an intervention, but especially one for a particular population, like let's say older workers, what is it that you're trying to improve and what needs to be changed, and stay focused on that in the intervention. Keep an always on that. And sometimes what you'll find is you may think that you know what the issue is, you've got a handle on it, but once you start talking to stakeholders, it might not be exactly what they're looking for, and it's important to get them involved. The other thing is to keep in mind, as the point I mentioned before, is the intervention to address an age-related problem or to prevent the problem from happening. And I think often organizations don't think about that second question about prevention, and I think it's a really important issue. And the way I like to explain this is that we wouldn't let younger people be exposed to chemicals when they're young that we thought was going to make them sick when they were older. In the same way, we should be thinking about the workplace in other ways as well. What can we do to not expose people to things that will make them hurt their well-being or their health as they get older? We need to make interventions practical and affordable. And one of the things that we think is really important is that this will get organizations to adopt interventions if they see that the interventions are fairly easy to use, clear to use, and not difficult to undertake and not overly expensive. One approach that fits with this is this concept of using WISE interventions, which is a brief but highly focused and simple interventions. And that citation I have at the bottom of the slide by Walton in 2014, this is a really, I think, a nice way to think about interventions. Sometimes interventions have to be very resource intensive, but sometimes they don't necessarily. Sometimes it could be as simple as a training program. Other lessons here is, again, involve stakeholders, whether it's employees, supervisors, managers, and unions. You're going to get more acceptance and more uptake of the intervention, and it's going to be a better intervention that fits those people. Going along with that, be sure to get support from the top. And a lot of you, I'm sure, have been in this situation when there isn't support from the top, it doesn't tend to go over very well. And that's so important. Think of ways of promoting uptake to be sure that people actually participate in it. I keep coming back to this. I think the biggest issue is getting people involved in the development of the intervention. But you can also give incentives. I think the only issue sometimes with incentives is if you incentivize, let's say, by giving people money, sometimes they may not be as engaged with the intervention as if they actually really developed it and had become involved in it themselves. And it's also important to benefit workers of all ages. There's a study that I did not mention that studied HR practices and age-related HR practices, and what they found is that the most effective, this was a German study that was done about 7 or 8 years ago by Stefan Boehm, and they 93 companies, and they found that organizations that had good supportive HR practices that supported people of all ages, not just older people or younger people, had the most positive age diversity climate and had lower turnover and higher performance. And it's really a pretty compelling argument that try as much as you can to benefit people of all ages and not favor one group over the other. And then finally, to evaluate, what outcomes are most important? Is it well-being, performance, workability? Even just evaluate whether people thought that it worked or thought that that was a good intervention. But some sort of evaluation, I think, is really important. I also think that some of the more simple evaluation questions can simply be: did people think it was useful to them and helpful to them? And that can give you great feedback. And if it doesn't work, it doesn't. Maybe it means that you should stop, or it could simply mean that the intervention needs to be adjusted in some way. And the last question I want to talk about with evaluation is this issue I brought up before: is like, when does it work? It's not one size fits all in terms of interventions. Think of the particular population. How do you need to change it? Some of the things that I found in some of our own work with this is that examples are just changing the photographs. If you're doing an online training, that making sure that the photographs that you're using in training fits the particular type of workers you're aiming it towards. And there's these little things like that can make it make training more effective, make the intervention more effective. But in any case, do think about whether it works it's appropriate for your group, your industry, your culture, and for whom will it be most effective. And I think this is another, in addition to uptake, when does an intervention work and for whom is another. These are both big questions in intervention research these days. And that is it. Thank you very much.
Thank you so much, Donald. I don't know if you can hear the audience was clapping. So thank you so much. So I'm going to invite questions from the floor, and I think we'll also see whether some come up on Slido. So first of all, questions for Donald. John.
So I think this is a really interesting area, and I think it's extremely important. And what I've heard of some, I'm not in your field at all, but I've heard of some of those interventions, not all of them. But what strikes me about this is that although when these interventions are documented, often there are improvements in the way firms operate, like the BMW case with 7% productivity improvement. My sense is that the adoption of any of these interventions is not at all widespread. Most firms do very little of this. And when they do, it's mostly quite tokenistic. So if there are these benefits, financial benefits, productivity benefits to be had from these interventions, why are they not more widespread?
Thank you, John. Donald, I'm not sure if you got that, but I have to repeat it for the online audience anyway. John has asked, there's great evidence from these sorts of interventions that there can be real benefits. So why then are there so few of these interventions? Why then is there not more uptake if there are such good benefits to be realised for productivity and other outcomes?
And I think if I understood the question correctly, uptake by organizations, is that what you mean?
Yes,
Like,
yes.
yeah, okay. Yeah. And so, because I do want to separate that from uptake among employees, which is they're two separate issues. Uptake among organizations, one of the focuses that we had done at the Oregon Healthy Workforce Centers, one of the approaches we've taken was that often interventions are very large and elaborate. And the more that that's the case, it's just too much for a lot of organizations to undertake. Or it seems like a very large investment. I think this is why this focus on wise interventions is so important. It's one of the things that we were at least hearing in the States was that the more you could make interventions more easy, more accessible to organizations, so you could simply give them the materials and they could just adapt it to themselves, and trying to come up with versions that were not so expensive. So I would say the intervention that I described to you that we were involved in had quite a few moving parts to it, and it required quite a lot of resources and staff to be put together, not funded by the agencies that benefited from it, but actually funded by the federal government funded by NIOSH. And so I think it all comes back to, well, I guess it comes back to, first of all, letting organizations know what's available to them, but making interventions that are understandable, not necessarily expensive. And this whole focus on wise interventions that I mentioned, I think is really important to get organizations to see that there's a benefit that sometimes can come from a smaller version of these. And so I guess it comes down to the wise interventions. And I would also say if people are interested in sort of more accessible tools that can be used by a lot of organizations, I would check out the Oregon Healthy Workforce Center's toolbox is what they call it. There are all these tools that organizations can choose from, and they can see what's worked in the past and they can choose what will work with them. But I agree it's a major question, but that would be my take, is that we're working on it and it's making it accessible and relatively easy for people to use.
Thanks, Donald, that's great. And I think I would just add to that there's also some role potentially for management consulting firms and things to help scale these things up too sometimes. Sometimes it's not possible just to do it as research teams too.
I absolutely get, and I'm glad you brought that up, Sharon, because sometimes it's possible for an HR person who doesn't have much other background in this to take it on, but other times it might require bringing in a consulting firm or something to assist with it. Absolutely, yeah.
Great, thank you. And we do have another question up the back there, Marian.
Thank you, and thanks, Donald, for that really interesting presentation. It reminds me of some of the earlier human high-performance work management literature, which sort of suggests that often it's the companies that are already performing well that are able to take up these practices or try these interventions. And it's not the poor performing companies that really need them that undertake these interventions. So it's one of those conundrums we have, I suppose, is how do we reach those companies that really do need assistance, but going to that resources issue, don't have the resources to try these interventions?
Yeah, or even the motivation. Yeah, so the question there, Donald, is that a bit like the high performance work system literature, is there a sense in which the good companies take up these interventions and the companies that are perhaps the bad companies or the ones that really should be doing it are the ones that don't have the capacity or perhaps even the motivation to do it? And how do we sort of spread to get those companies that really need it involved?
That's a really hard question, and I agree with you. I mean, I think of a couple of the examples I gave was BMW and LL Bean, and I mean, certainly LL Bean has a reputation for being very good to its employees. I think you're asking a really good question. I think that it's making it accessible, and also just trying to explain to people how, coming up with let's say, published research that's not just in academic journals, but might also be accessible to practitioners like HR types of outlets. I use as example is that I don't think that I think they're good organizations, but the public sector organizations we worked with would not have been able to undertake that without the resources we brought with them on the grant. But because I think what you're also talking about is the culture of the organization, right? I mean, it's sort of like one of the things that we talk about is a total worker health approach. And this is another thing that's been played up by NIOSH in the States in the last several years, a total worker health approach. And I can actually, that was in one of the citations I had in one of my slides, was talking about total worker health. But total worker health, the idea is that an organization that focuses on safety, the health of its people, the well-being of its people, they're all correlated. Those are all, it's sort of, these are organizations that are high performing. And so what NIOSH as a federal agency has been trying to promote is total worker health and thinking, don't just think safety, don't just think well-being, don't just think health, think, how can you do all of these things at one time? And not at one time, that makes it sound impossible, but they're integrated, and if you have people who are ill, they're going to have accidents, or if they're distracted by things that are going on at home, by well-being things, they may not be safe. And so I think it's really important to think of it that way and hopefully get it out there. But I agree that it's harder to it's a dissemination issue is what the way we refer to it is. It's how do you get this out? And that's what a lot of the NIOSH funded centers in the States are trying to do, is to disseminate interventions that they've tried and that work. But then again, it's, who's going to undertake that? There has to be a champion in the organization to do it. I'm sorry, going on a long time. But I completely understand your question.
But actually, we're talking about policy today, and maybe there's a role for national level policy perhaps here too. I'll take one more question and then we'll have to wrap up.
This was on the issue of promoting uptake by individuals. Apart from incentives, I wondered if any lessons were learned about how to promote uptake by individuals. I mean, I can think of a couple of things. If a whole team goes to yoga, it's probably easier to go to yoga. Or if your workload doesn't sort of preclude getting involved in fitness programs. But I wondered if actual lessons about individual take-up came.
Yeah, great question. So, Donald, this is about individual level take-up. So other than incentives, what sort of things do you think might facilitate more individual level take-up? And the couple of suggestions that were made, things like maybe if the whole team goes to yoga, or maybe if the workload is not prohibitive and so on. So any thoughts about what else can motivate or facilitate individual level uptake of these initiatives?
I think that the idea of the group becoming involved is a very important issue. And in fact, this is why we integrated that into our intervention, this team sort of process. So it wasn't just the supervisor trying to have better communication in the team. It was also trying to get the team to be speaking more with each other and to be thinking about these issues like safety, supporting each other, work-life balance, health. And I think it's very important. And the only caveat I'd give on that is that because I think the team and the culture has to support this. The culture of the team, the norms of the team, the culture of the organization has to support it. And I would only hesitate when I think in terms of interventions where they try to get teams involved and maybe have competitions or have people feel coerced in being involved in something. I shy away from a bit. And I've also heard I can't remember this person's name. There's a social psychologist that gave a talk several years ago I heard that I thought was interesting, talking about if you incentivize too much externally, like rewards, you don't get people to internalize, you don't have them intrinsically motivated, and they're not going to stick with the intervention as much. And the example he gave was the sort of workplace smoking cessation programs. If people don't want to quit smoking, you simply pay them to quit smoking. They may not. There may be some recidivism. But but overall, I agree that thinking of it at not just the individual level, but at the group and organizational level as well is really important. And I guess I would say one last point would be, I think that the supervisor is a really good anchor to get that a lot of times. And getting the supervisor to work with that and work with the team, that can really set the team, this team climate. And I think that can make a huge difference as well.
Great. Thank you so much, Donald. I think we're out of time, but I think there was a fantastic end to our day. We have a panel discussion now where we're going to sort of bring things together, but we've really travelled from the more macro interventions at the policy level right down to the things that managers can do in organisations. So thank you so much, Donald. Have a great sleep. I hope you're not too hyped right now.
Thank you.
And I look forward to catching up with you very soon. And everyone's giving you a big clap.
Thank you, everybody.
Down here.
Thank you.
Thank you so much, Donald.
Okay. We're just getting organised for our final session of the day, a panel session. Thank you, everyone, and apologies that I've got my back to the audience here, but I really would like to welcome Dr. Kay Patterson, Age Discrimination Commissioner, to this afternoon's panel session, Associate Professor Myra Hamilton from the University of Sydney and Principal Research Fellow at the ARC, Centre of Excellence in Population Ageing Research, Professor Sharon Parker, who we've already heard from this afternoon from Curtin University, CI on CEPAR, and the Director of CEPAR, Professor John Piggott. Kay, I'll give a short bio for you briefly so our viewers and audience can know a bit more about you. Dr. Patterson began her role as Age Discrimination Commissioner on the 29th of July 2016. Her strong interest in issues affecting older people has been demonstrated throughout her professional career. After gaining a BA Honours at the University of Sydney and a PhD in psychology and DipEd at Monash University, Dr. Patterson taught allied health science for 11 years. She went on to study gerontology in 2 universities in the USA and used this knowledge to co-develop the first Victorian postgraduate diploma in gerontology and to introduce gerontology into the undergraduate behavioural sciences courses. Following her election to the Senate in 1987, she served on a number of Senate committees and held various shadow portfolios. In 1988, Dr. Patterson was appointed a parliamentary secretary and in 2001 was appointed to Cabinet and served in the health and social security portfolios. During her time in the Senate, one of Dr. Patterson's major areas of interest were issues affecting older Australians. She retired from Cabinet in 2006 and from the Senate in 2008. Dr. Patterson has served on a number of not-for-profit boards and voluntary positions. She's currently Director of the Brocker Foundation and Honorary Professorial Fellow at Monash University. And as you can hear from her background, has enormous knowledge about older workers and Australia's older population. Kay, I'll ask you first to make a few comments and we can see you clearly, so over to you.
Thank you very much, and thank you very much for that introduction. I want to thank CEPAR for inviting me to speak to you today. I'm sorry, I'm in lockdown 4 in Melbourne, and I envy those of you who are sitting there actually with other human beings. It must be lovely to be in that situation. I think people in Victoria are getting a bit tired of lockdowns. I want to acknowledge the Kulin peoples as the traditional owners of land from where I'm speaking today, and to pay respect to their elders past, present and emerging. I've made it my priority during my time as Age Discrimination Commissioner to focus on 3 things. People say to me, what can your department do for me? I've got 2 staff at EA and 1 sort of seconded person till October, and me. So the department's pretty small. So I've cut my coat to fit my cloth. And the 3 things I'm looking at: older women's risk of homelessness and age discrimination in the workplace. So there's 3 major things, but I do other things on the side, like granny flat, capital gains tax, and those sorts of issues I call the rats and mice that are part of it, but not the sort of core areas of interest. I'm delighted to join you today to talk about some of the challenges and opportunities around employing mature workers in organisations and the role that policy can play in supporting this. Just want to say, although we're focusing on older workers, I want to make sure we understand that younger workers are often discriminated against as well in the workplace. So it's an area that I'm beginning to sort of focus a little bit more attention on as they've been affected quite significantly by COVID. As we see shifts in mature workforce participation, we need to ensure, in the context of challenges and opportunities we're now facing, ageism is not an unintended consequence of public policy discussions and implementation around supporting the employment of older people. When it comes to the workplace, age discrimination can occur at a number of points, at the point of recruitment, as well as in relation to opportunities for training, promotion, and flexible work practices. And it can also affect how strategies around retirement are approached. As Australia's population ages and our health span, the number of healthy years in older age increases, along with lifespan, policymakers and organisations need to be prepared and have strategies in place for employing and retaining older employees. I think it's hard for us to just imagine. I remember meeting the first person that I met in Sydney who was 90, and I touched him because he'd been at the opening of the Harbour Bridge. I just had never met a 90-year-old. I'm 9 years older than my grandmother was when she died, and now 6 years older than my mother when she died. So it's one example. I mean, an N of one isn't very good, but it's just an example of many of us haven't had experiences in our family of people living as long as we have. This issue of age discrimination and the need to employ older workers is becoming more relevant as we see the impacts of COVID-19 on the workforce. There are barriers to employing older workers, and unfortunately, one of the barriers is age discrimination, and a significant problem in Australia. We just released the report of the third joint Australian Human Rights Commission and Australian Human Resources Institute survey of human resource professionals, employing and retaining older workers, as it's called, and was released last month. And the first joint survey was conducted in 2014 with my predecessor, and the last one with me in 2018, the next one in 2018, the next one in 2021. A quick summary of some of the key findings, and you'll see the full report on the Australian Human Resources website. The good news is there's a satisfying ongoing drop in the number of organisations who say they definitely or probably have an age above which they are reluctant to recruit. That was 52% of people in 2014. It's down to about 27% now. Sorry, 30% in 2018 and 27% now. Most of these changes were due to an increase in those who answered maybe rather than definitely not or probably not. It was heartening to see an increase of 14% since 2014 in the number of people who recognise that the departure of older workers causes a loss of key skills or knowledge. Unfortunately, at that same time, there was little or no increase in organisations who capture the corporate knowledge as older workers transition out of the workforce. So people go, often with stuff they've had in their head, they've done something, or they've always rung, I'm saying real estate agent, they've not rung people up when they've said, I'm not interested in purchasing this property and annoying them. I've chosen to only ring people who've shown a real interest in this place. And they don't write it down, but why are we not capturing what the successful employees do, which they haven't written down? And that's some of the things that they were saying in this report. It's also concerning, this is really odd, that the perception of what constitutes an older worker has shifted to a younger age over the three surveys. That caused a bit of hysteria amongst the media, and all the ones who rang to ask me to talk about it said, oh, I've just turned 50. And what had happened was we saw a marked increase in those respondents selecting 51 to 55. That was 11% in 2018 as being old workers, and went up to 17% who saw 51 to 55-year-olds as older. And I was interested in the way it sort of sparked much more interest than the previous report, because we saw the young age at which people saw employees as older was becoming younger. Now, I wonder if that's a COVID effect. Here's my little bit of research hat, my former research hat on. Is it that because we moved more to IT platforms and using IT and working from home, that maybe recruiters thought, oh, older people aren't, the myth, older people can't do IT. Now, I'm talking to you from my upstairs bedroom, and I've got a green screen, and I've got I can put a different background on for you. I've been quite able and as agile to go from about 4 or 5 different platforms. Some of them better than others. Teams, some horrible one the public service uses, which is just awful, Zoom, etc. So I just hope that when we do another one, and I hope we can do one in 2 and a bit years, I wonder if we'll hopefully see that effect wash out. If it's not, it means it's more endemic, and we have to wonder why. But I do hope only hope it's an effect of COVID. But at the same time as this all was happening, there was an 8% drop in those selecting 61 to 65 as older. I also note the pre-COVID data from the, I think it was the CEPAR 2019 survey of over 2,000 workers from a large number of Australian organisations, and showed some evidence that older male professionals perceive more discrimination than women. You may have covered this earlier today, and are more likely to act on it. And professional women report more age discrimination mid-career than men, but by age 55 that's reversed, and women are becoming more satisfied and men more likely to feel they're missing out on opportunities and being sidelined. Now, we also know from pre-COVID-19 unemployment data that once older workers become unemployed, they face much greater difficulty finding subsequent employment compared with younger age groups. And those figures, on average, younger people aged 15 to 44 are unemployed for 45 weeks, compared with 76 weeks with people aged 55 plus. So we've got a much longer time for people being on unemployment benefits if they're older. A Parliamentary Budget Office paper released in September 2020 found that employment data for older women was worsening before the pandemic. This is a shocking figure. In 2001, women over 50 made up 5% of all job seeker, formerly New Start recipients. Now, 5%. In 2019, they made up 20% of job seeker recipients, highlighting the trend that was appearing where older people were exiting unemployment benefits to the age pension rather than a job. Age discrimination is one of the contributing factors behind this data. For example, older women working in customer-facing industries such as retail or tourism are being passed over for younger candidates. Now, I've got a large bed, bath and table type, sells household goods, and there are nearly all the employees are older women, and it's much nicer to go to someone when you're trying to choose a frying pan. This one's better because but you need to do this with it, than somebody who's never cooked in their life. And I think some companies don't realise the benefits of particularly having older workers in customer-facing industries, especially where they're dealing with older people or using their life experiences. In that 2020 joint Australian Human Rights Commission report, and done with the Australian Human Resources Institute, we found that 58% of older workers have difficulty gaining employment or being retained as an employee. They have found this, or being retained as an employee during COVID. The ABS data coming through on employment impacts of COVID-19 highlights that oldest and youngest workers are the two age cohorts bearing the brunt of unemployment due to the pandemic. As I said, age discrimination continues and is widespread. There's still a lot to be done. I want to mention briefly just the two formal frameworks that I work under, the National Age Discrimination Act, which was passed in 2004, and I remind businesses it's unlawful to treat a person unfairly because of their age in different areas of public life. And the complaints which come to a quite independent section of the Commission, mostly only about 8% are age discrimination, but the majority of those are about discrimination in the workplace. The Australian Human Rights Commission Act 1986 allows the Commission to investigate individual complaints of discrimination, including age discrimination. So they're the two pieces of legislation that I operate under as the Australian, the ADC, as they call me in short in the Commission, the Age Discrimination Commissioner, and the Commission as a whole. Before the pandemic, we were seeing some positive shifts in workforce participation by mature age workers. Australians are increasingly working to older ages. In 2019, 75% of people aged 55 to 59 participated in the labour force, working or looking for work, that is, and this is up from 70% in 2009 and 60% in 1999. 1999, it's not all that long ago, really. 59% of those aged 60 to 64 participated in the workforce, up from 50% in 2009 and 33% in 1994. 20% of people over 70 did some paid work, and the other fascinating figure is that 5% of people over 100 have participated in some form of paid work. That's quite amazing, really. And I just got some data the other day that 82%, that the oldest person working in the Australian public service is 82. thank you to me, because it took me 9 years to get rid of the compulsory retirement age in the Australian public service. I don't want to see these gains derailed by COVID-19. There's significant changes, but we've still got a long way to go. We're also seeing data which indicates that more Australians want to work longer and retire later, often in stages. In times of economic disruption, it's not unusual to see trends in people delaying retirement. Roy Morgan data from June this year showed that in February, 10% of 60 to 64-year-olds and 54% of 65 to 69-year-olds plan to retire in the next 12 months. In March, this dropped to 8% of 60 to 64-year-olds and 39 dropped down to 39 of 65 to 69-year-olds. A 2020 survey by Colonial First State Super, Retirement Realities, was released in August 2020, found that 45% of Australians surveyed were either scared or do not feel very financially confident about retiring, with women more adversely affected. 23% of Australians in this piece of research aged 30 to 65 said they would be forced to delay retirement as a result of COVID. Whenever I speak to employers, and it really interesting, a very large drug company invited me to speak to their inclusion, a group of people, HR people working on inclusion, to actually focus on older workers and multi-generational workforce. And I went, hallelujah, they approached me. So hopefully the message is starting to get through about the value of a multi-generational workforce. Whenever I speak to employers, those in leadership roles and human resources professionals, I mention a few strategies for supporting a mature age workforce. They could consider collecting data on older employees now 45 and over, both existing and new employees, so they know the state of play and are well placed to develop the right strategies for their circumstances. I must just say here that I've also been pushing the Australian Public Service, and we've been working with the New South Wales government, because we can't ask the private sector to do what public sector is not doing. And there's really a strong interest now, and the Prime Minister's also asked all the departments within the APS to look at their policies and if there are any impediments to people continuing to work or moving across departments or staying longer. Organisations can look to build their capability in age management. This involves revising formal policies to ensure there's no unconscious bias and no age barriers for older workers to join and no incentives for them to leave, and work to update the attitudes among their staff to enable them to be positive about hiring and retaining older employees and becoming proactive in realising the benefits of a multi-generational workforce. This requires leadership and commitment, as well as an implementation strategy. There are some formal policies worth considering: a transition to retirement program, and that's not when they turn 65 and they think they're in the departure lounge. It's better, and one of the major companies has come to me, a major mining company, talking to their people at 45 and 50. How much longer do you think you'll need to work to pay off your mortgage? What do you think you might need to do if you can't physically do the job you're doing now? How can we help you do that? What sort of loyalty will that instill in the workers when they see their company looking after older employees and in giving them the flexibility that sometimes need to their caring responsibilities, time off to go on a women's weekly tour, which is one of the companies down in Wollongong's done, giving them a year leave of absence so they can go and travel and come back and use the skills and knowledge they had from when they were employed before. There may be unconscious or other incentives for older employees to leave, and as I said, capturing their knowledge and their skills that is important, and reskilling opportunities for older employees to transition to less demanding, as I said, less time-consuming role, and collecting data on how many employees are over 50 and how many have been employed, mechanisms to review training and development needs and opportunities for all employees, not just choosing young ones to go to do training, and strategies to ensure line managers encourage employees of all ages to participate in training and development, and opportunities, as I said, to talk about career pathways, and to recognise long service. And people used to get, I don't think I should talk about watches at the moment being given as rewards, but long service awards and recognition and acknowledging people's contributions are important. The other thing is looking at the benefits of cross-mentoring, both younger mentoring older people and vice versa. And I've talked to some companies, one company raised with me, that they found job sharing to get flexibility for younger workers, mums with children, and older workers. The worst thing you could do is put two young mums together. They both wanted school holidays at the same time, so they started a job share between generations. when the older people didn't want to go on school holidays because it was more expensive, and the younger people wanted holidays. So just a creative thing of not giving in a mindset that jobs should be shared by people who look the same and have the same needs. So I think being creative, being focused, not being discriminatory is absolutely important. Also, Susan Ryan, in her Willing to Work report, recommended a collaboration and a partnership on mature age employment across not-for-profits like Brotherhood of St Lawrence, Australian Human Resources Institute, the Small Business Hotels Association, and we have a collaboration built on that recommendation, and that meets on 3 times a year, but it gives me a lot of contact with businesses, and we've got people who maybe have never met before. We created the partnerships, created a mature age hub, and there are some, I won't go into, but some of the government programs that we also try and promote for employing older people. And overall, there have been some solid gains, but I think we need a reset switch, especially as COVID has highlighted some of the holes and some of the problems and some of the ageist attitudes. And we need people to, what I'm hoping to do now is to try and find a way of promoting through that hub some creative things that businesses are doing to have older workers we've done gender, LGBTI plus, but ageing's being missed out. And as I keep saying to people, the culture you set now is the culture you inherit. So if you think somebody's old at 50, you're going to be there very shortly and you won't want that label placed on you. So thank you very much. And I want to say again to CEPAR and to all the people involved in CEPAR how much I'm sorry I don't see you as often as I would like to, but I've only got 24 hours in the day. And some of the other issues, elder abuse is particularly demanding at the moment. It's gone up almost 100% in terms of some of the measurements we've been doing over COVID. So I just want to say thank you to everyone who's particularly interested in this area, because it's absolutely vital, not only for the economy, but for the individuals who need now not to eat into their savings and not knowing how long they're going to live and not be discriminated against when they're applying for jobs. Thank you very much.
Thanks. Thank you, Kay. That was a fabulous overview and actually picked up on many of the things that we have discussed today, but you were able to crystallise the very issues that we're experiencing in Australia. Appreciate your time very much, and especially that you're in lockdown in Melbourne. We hope that you'll be able to be free and roaming around very quickly.
Oh, yeah, we're going to be allowed to go 25 kilometres from home as of tomorrow at midnight tonight. Well, that's really exciting.
Go and enjoy it. Thank you. I'm now going to hand over to Associate Professor Myra Hamilton. Myra is Principal Research Fellow at CEPAR with me in Work and Organisational Studies in the University of Sydney Business School. Myra is a sociologist with over a decade and a half of experience in social policy research and advocacy. Myra, over to you.
Thanks, Marian. I'd like to acknowledge the Wongal people on whose land I'm talking to you from today, and to pay my respects to their elders past, present and emerging. I didn't intend to be on Wongal land today. I had planned to be in Canberra with all of you, and I'm disappointed that I can't be there. I'm instead in my home waiting for a COVID test result. But it's been a wonderful day remotely. So I want to try to bring together what we've learnt in the several earlier sessions today on the macro and the micro by drawing on some of the work we've done in our CEPAR teams at the University of Sydney and Curtin University. So starting with older workers, we know from our work with mature workers and from what we've heard today that many have unpaid care responsibilities for children, grandchildren, older relatives and relatives with a disability or illness, like we learned earlier in the work of Linda. Many are managing chronic health conditions themselves, such as in Christine's paper. Most want opportunities for skills acquisition and career progression, but don't always receive it, as we heard from Raf and as we found in our own work. They have skills and experience that is not always adequately valued and recognised, as we heard from Marian. So what have we learned about what this means for workplaces and policy, and what can we do better? Well, I'll start with workplaces. In workplaces, I'd like to discuss two issues that have jumped out for me: age stereotypes and bias, and job security. Age stereotypes and bias. Well, in the work we've done, we found that even in large organisations with a fairly strong emphasis on diversity and inclusion strategies and policies and on flexibility, mature workers often felt as though their contributions, skills and needs as mature workers were not recognised or valued. In the studies we've done, diversity and inclusion policies didn't specifically make mention of older workers, only other groups. And there weren't many policies aimed at explicitly recognising the contributions of older workers. Like there weren't any mentorship programs that Sharon mentioned earlier have such value. And the mature workers were often subject to implicit or explicit age stereotypes, like assumptions that they wouldn't be adaptable. We also found that well-developed flexibility or job design policies were not necessarily explicitly developed with reference to the needs of older workers, or at times were based on stereotypes about what employers thought older workers would want. So, for example, when the mature workers in our study requested a shift from full-time to part-time work to accommodate health or care responsibilities, or just to have a bit more time, managers often categorise this as a transition to retirement, and the move sometimes required the mature workers to change roles or opt out of training and career progression opportunities. But they still wanted these things, they just wanted a few less working hours. Likewise, we found well-developed OH&S policies that didn't explicitly recognise the needs of older workers. Mature workers told us that the physical challenges that they experienced in the workplace as a result of ageing were often not specifically addressed or managed by the organisation, which shaped their opportunities to carry out their work in ways commensurate with younger workers. For example, in one workplace, the daily tasks of work involved walking on uneven surfaces, which placed considerable challenges on some of the older workers. For us, we see all of this as a consequence of the implicit construction of work as the domain of the young and youthful, which means even in organisations where there is a strong emphasis on diversity and inclusion and on flexibility, they can still be implicitly underpinned by ageist assumptions about the embodied or cognitive resources of the ideal worker that may marginalise the contributions and needs of older workers. Organisations need to more explicitly interrogate the assumptions underpinning their inclusion and flexibility and other policies to facilitate the adequate recognition of older workers and their value to the organisation. The second issue was job security. So, as Raf said, while casual work is more common among younger workers, there's still a considerable proportion of older people in casual work, 1 in 5, I think he said. And our work on older single women using Hilda has shown that job security decreases as they age. This is important. We found that the age bias experienced by older workers gives them a greater sense of precarity in work. They feel at greater risk of job loss during periods of restructure and highly concerned about finding work as a mature age person should they lose their job. And this reflects the reality. We know from the administrative data that older people find it more difficult to find work than young people. As a result of this, job security is very important for older workers. In a recent study we did with older single women, we found job security was more important to them than income. The other reason job security is important for older workers is the access to the opportunity that secure or permanent work often entails. As Marian mentioned earlier, casual workers often don't get access to leave, to flexibility, or to opportunities for career progression in the way that permanent staff do. These things are important to older workers' capacity to and interest in remaining in work. Mature workers in our own work tell us that leave is essential to enable them to stay in work while managing their health needs or care responsibilities. We also know from the work of Sharon, Daniela, Jane and the team at Curtin that opportunities for skills development and training remain important for older workers, stimulating these important intrinsic motivations to continue working. This suggests a need to focus not just on longer working lives, but as Sharon mentioned, on good quality working lives characterised by secure and meaningful work. So what about policy? Well, there's an important role at the policy level, of course, in creating the legislative frameworks to support the reduction in age discrimination and stereotypes in workplaces, the Commissioner's domain, and to value or promote secure work. But when it comes to policy, I'd like to talk about the broader picture today. I think the valorisation of the economic contribution of mature workers and the financial benefits of working longer has focused the policy lens on employment and retirement incomes policy. But I think we need to look more closely at the broader policy context that will facilitate mature age work. Working later means that we're reconciling work and care in later life. But currently, the employment and retirement incomes policy settings and the family and care policy settings don't align. Our employment and retirement incomes policies encourage people to work longer, but our family and care policies place pressure on older people to provide unpaid care in later life. For example, the large-scale entry of mothers of young children into paid work, combined with barriers to accessing formal early childhood education and care services, means more grandparents are providing regular childcare. And more care of older people in the community and the shift towards consumer-directed care means more involvement of family carers in the care of ageing relatives. Grandparent care and care of ageing relatives is mostly carried out by mature age people. Many people do both at the same time. So large numbers of older people are combining paid work with unpaid care. But family and work care reconciliation policies aren't calibrated with mature age employment policy and retirement incomes policy. Leave is a really good example of this. Parents of young children have access to 12 months at least job protected unpaid leave and 18 weeks of parental leave pay. The paid period is too short, but nonetheless, evidence suggests that this reduces the likelihood of mothers of young children dropping out of work. But if you're a mature worker providing care for an ageing relative or a relative at the end of life, you have a maximum of 10 days of paid leave per year, and that's if you work full-time and you give up all your own sick leave, or 2 days of unpaid leave at a time. And we know that providing care is a major reason cited by mature work, leave work entirely, and why they can't re-enter work. Some countries have extended leaves of 3 to 6 months for elder care, palliative care, or care for a family member with a disability or illness. And this, of course, needs to be combined, as Raf mentioned earlier, with more affordable and accessible formal care services. So all of this will help mature workers stay in work longer. So if we have a greater focus on the wider range of contributions of older people, not just economic participation, this would help us better understand the factors shaping older people's patterns of and opportunities for participation in work, and to take this more holistic approach to public policy making for mature work. Thanks.
Thank you, Myra. That was a wonderful overview of today's presentations, but also drawing our attention to that really important policy question of how we actually make our policies align, those policies that are focused on labour market participation and those that are focused on care. And at the moment, those two policies, as you really nicely illustrated, do not align. While you were talking, unfortunately, we've gone into darkness here. So, but I have to say, Kay and Myra, you are the shining lights because you're providing us with all our illumination. both physically and in terms of our mental capabilities at this time of the day. So thank you very, very much. I'm now going to ask Sharon and John, who are here in the dark, to provide a little bit of insight and a reflection on their view of today, thinking very much about the policy implications of what we've been talking about today. And by policy, I don't just mean state policy, but also organisational. And as we've heard a lot about team, leader or supervisory actions and practices. So I'll go first to Sharon and then to John for a few comments. Thank you, Sharon.
Thanks, Marian. Can you hear me okay? Yeah. I just can't get out of my head the joke about how many psychologists does it take to change a light bulb? Do you know the answer to this one? It depends if the light bulbs want to change. Clearly they don't. Look, I just jotted down a number of sort of questions and comments. So I don't honestly have a profound synthesis, I'm afraid. I just love that question at the beginning that Raf raised. Should we be more ambitious about labour market participation in mature workers? And I think we should. And we're the group to do it. So that was one question I'd love us to come back to. I think another discussion point is the relative value of policies focused on mature workers versus sort of general policies. I'd really love to hear people's thoughts and reflections on that. What are the pros and cons, and so on. I keep wondering, and Raf, this is something I feel like, is in your territory, but given right now we've got this shrinking of the labour market because of the lack of migration at the moment, isn't this the ideal opportunity for employers to care about recruiting mature workers? Because aren't they all struggling to get talent? Isn't there some opportunity here right now at this time? So I'd love your thoughts on that one. Yep. You talked to me about the balloon metaphor. We were chatting about this last night. Isn't now the time to get the balloon metaphor out there?
Yeah, actually, one of the things that we wanted to do one bit of work that we wanted to do for the brief, but we ran out of time and space probably to fit things into that research brief, is to look at skills shortages and then skills and occupations of older people and try to match that up. The thing is that because the brief is looking at a much more longer term, we didn't really focus too much on that sort of short-term filling in. We do mention that structural change in the medium term is a policy objective, and that older people could be part of that. But yes, I see no reason why.
Like in our MWAS survey, I can't remember the exact statistics, but I think it was around 45% of younger workers agreed that mature workers should, or older workers should, make way for the next generation. It's a very strong belief, right? And it's a belief that needs to be challenged amongst employees, amongst employers, and I feel the time is now. Because aren't we really seeing that right now, that we've got this labour market there that we could draw on? I don't know, I'm not an economist, but it just feels to me now's the time to be trying to tackle that message head on. Yeah, so that was another thought.
Yeah.
Yeah.
Great questions,
I've got
Sharon.
more, but I'm more than happy to pass over to John.
I just had a couple of observations, and it's sort of around the macro-micro link. I asked a question this morning around policy coordination, and I do think employment policy, which is somewhat piecemeal, right, and retirement income policy and aged care policy do need to be coordinated and seen side by side. And this is something that Myra has brought out and something that Marian has referred to. But I think it's quite important that it be seen like that. And my impression is that that doesn't happen very much in the policy debate within the country. In fact, this is possibly one example of where we're focusing on mature labour force, but of course we are not focusing on retirement incomes or aged care. So I think there's room for greater integration, and maybe that's something that we can think about over this next period. When I think about the mechanism for how that could fit together, I suppose I head for the tax system. So it's really the taxation system which generates so much action in retirement incomes. The taxation system and the associated subsidy system is what we have in terms of aged care. And the taxation system could act to the extent that we need government interventions in mature labour force, could act as an incentivising force for organisations in that context as well. And so I think there's certainly room for some further thought around that into the future. So one reason that Sharon is sitting here is that it was our perception as we came to bid for the second round of CEPAR that when we thought about mature labour force, a lot of attention had been paid to the supply side of the labour market, to households providing or not providing labour into the market. But actually relatively little attention had been paid to the demand side, and there was much evidence and even more stories about how employers were reluctant to turn to the mature labour force. And so we thought it was important to have a stream of research within the second CEPAR that focused on that side of things. And that's where Sharon and Marian, where that stream 3 of our research sits. And I think I've been fascinated by the way in which that has been pursued over the past several years. And listening today, there were just 2 things, I think, that I would wish to comment on. One is around discrimination, and I think there's obviously ageism exists, and we need to find ways of reducing ageism towards zero. I'm inclined to, it's what the road toll people say, right? Towards zero age discrimination. And it's very implicit, right? And something that hasn't been mentioned today is how it impacts individual expectations and social expectations around participation, social participation more generally, right, amongst older people. I think that's an important element of this that perhaps has received less emphasis than it might. The other is around lifelong learning. I was very struck by Tim Rawlings' comments earlier this afternoon. I think lifelong learning is dramatically important and very underdone. So Raphael Chomik and I wrote a paper for the Asian Development Bank about the interlink between aging and labour supply and technology change in emerging economies of Asia several years ago. And one of the things that came out of that was that there was almost no systematic attention paid to lifelong learning by policymakers. Now, we've heard that maybe firms do this informally and that larger firms do it more, right? But it seems to me that it's still not done enough. And we need to do it with the more rapid technological advance. We need to do that more. And I think there is room for governments to play a part in this so that firms aren't all that much incentivized. I was talking about this with Warwick in the break, aren't all that much incentivized to provide training to employees which allow the employees to go and get a better job in another firm. But if all the firms did it, because they were subsidized to do it, maybe that would not be such a big issue. Right? It's kind of like a pooling equilibrium versus a separating equilibrium, if there are any economists in the room. And I think that probably requires some policy attention and some coordination between employment right? And tax and the various elements of policy that I've already mentioned. And then the other I that I just wanted to comment briefly on was integration. And I just wanted to have a slight caveat, because we hear about the complementarity between mature labour force and younger labour force and how that has potential synergies. And I think that's true, it does. It's worth bearing in mind, however, that the mature labour force is a selected labour force. Right? That people who aren't good at working, people who aren't, what's the word? Congenial, was that the word? Agreeable, have probably dropped out of the labour force by the time they're 60 or 65 because they're grumpy old men. Right? And what you're left with is the agreeable group. Right? And I think that needs to be borne in mind as we think about how that labour force integrates, how that mature labour force integrates with the younger labour force. So they were my kind of observations out of the day. I think it's been a terrific day, and I think the start with Rafael Chomik and then the way that's been taken through, and then the contributions from the more micro side this afternoon, they've just been terrific. And I think the international speakers have been very good as well. So I had very little, almost nothing to do with the organisation of this policy dialogue. So I'd like to thank the organisers as well. Thank you very much.
Thank you all participants for weathering the difficult conditions we're working under. We'll hand over now to Warwick to end the day.
Look, I'd like to thank everybody who's been involved in this. I'd like to particularly thank the presenters, the chairs and the participants who asked wonderful questions. The organising committee led by Marian, Baird and Sharon Parker, but there were a number of other people involved. The administrative organisation, Silke Weiss and Rosanna Bastos Pinto have done a fantastic job. The lights have nothing to do with them. The lights are probably the result of budget cuts at the ANU. And this is a demonstration to the politicians out there who have some problem with universities is if you turn off the lights, you have real problems. And so I apologise, we don't know what's wrong, but everyone's tried. And finally, I'd like to ask the technical guys who did a great job recording and transmitting. I was sitting behind watching their skills and I was very envious, so I can't do that sort of stuff. I think that's everything. And finally, I want to thank John Piggott for his leadership of CEPAR. He does a great job. He claims he had nothing to do with the organisation of this conference, but in fact, he had a great deal to do with the organisation of this conference. And he kept his hands off probably an appropriate amount. So thank you very much, John. We really appreciate what you do for CEPAR and the rest of the Australian community in these areas in which we work.